Dear viewer, in this video we present a brief introduction to the new ICPC 3. My name is Kees van Boven and together with Huib ten Apel we are project leaders of the ICPC 3 consortium. The consortium, hosted by the Radboud University Nijmegen, the Netherlands, at the Department of Primary and Community Care, consists of several representatives from international bodies and scientific associations. The ICPC is the most widely used international classification for the systematic recording and organizing of clinical information in primary care. How did we make the choice of classes? The choice of classes, also called rubrics or categories, is based on the classes in previous version of the ICPC, enriched by proposals from the Wonka Classification Committee and from the consortium members themselves. As it has always been, the choice of classes is based on frequency of occurrence in daily practice. Those classes all have their own code. Less frequent morbidity items are captured as inclusions within the categories. We distinguish classes for symptoms and complaints, illnesses and problems, examinations policy, and for, new in the ICPC, information about functioning aspects. How is the classification composed? The classification is divided into chapters and subdivided in components and the components into classes. The classes have a code that consists of 4 digits. I will start with the chapters B to W, organized according to body systems, and chapter A. Those chapters all are subdivided in the components complaints, symptoms, and diagnosis problems. As an example, chapter R, the respiratory system. By clicking on the triangle in front of the folder opens and you see the components RS and RD, where S stands for symptom complaints and the D for the diagnosis. Then click on RD, triangle again. For example, you see RDO1, pertussis, whooping cough, the first one, in the disease component. If you click on pertussis, then you can see in the right hand window more information about the content of this class, such as a description of the disease, the inclusions, and the links to previous versions of the ICPC 1 and 2, and to the ICD, and to a clinical terminology SNOMED CT. If you look at the left side, you see the classes all show a color. The color attributes in the disease component indicate the etiology. These are the infections, the blue one neoplasm, then the injuries, congenital, and the other diagnosis. I will close this one. Chapter A is organized in the same way as chapters B to W. However, chapter A contains symptom and diagnosis that cannot be linked to one system or are linked to more than 2 body systems. For example, fever and tiredness are symptoms that can be linked to diseases from almost all body systems. If I close this one, go to the disease part. And tuberculosis, also in chapter A, is a disease that can manifest itself not only in the lungs, but also in many other body systems. Okay, we will now continue by looking at chapters that stand out from the more traditional chapters, the chapters that are organized and named according localization. First, chapter A1. In this new chapter, we distinguish classes where there is no obvious health problems. The classes in this chapter are meant to define an episode of care, Interventions carried out in these episodes are to be coded with interventions code in chapter A1. If we look at the components in the chapter, indicated by 2 digits, they are about family planning, general routine examinations, etc. Again, if you click on one of them, like oral and conception, you can see that the components are populated by classes with 4-digit codes. In chapter Z, the social problems, are the social problems affecting health, and they are classified under component ZC. In the ICPC 3, we distinguish more classes than in the previous version, as you can see. Okay, I close this one again. In the chapter with the Roman 1, intervention processes are the classes that describe the actions of the provider, the interventions. By clicking on the triangle again, the chapter opens with the different components. Both the diagnostic interventions, such as I click on it, do a physical examination, ask for a blood test, such but as well as the therapeutic interventions, prescribing medication, vaccination, giving information, can be coded. And in addition, it's now possible to record also programmatic care. Such as, I will open it, cardiovascular risk management, and also programmatic care for frailty elderly. I will close this one again. Fourth, and completely new in the ICPC, is the chapter Functioning in relation to health. This chapter provides a specific selection for primary care of activities and participations, activities such as solving problems, making decisions, carrying out daily routine, and also, I'll close this, physiological functions as balance, dizziness, and pain functions. In all these classes, it's possible to use the severity scale, see at your right hand. The scale from no problem to complete problem indicates the patient's opinion about the problem and not the opinion of the provider. Especially in this chapter, the classes contain the items which are of great importance to the patients, by which it can be indicated what a person can or cannot do. Capturing this information is also important to obtain an impression about the outcome of our interventions. We will go into this in more detail in a separate video. In addition to the 90 chapters that form the core of the classification, there are 3 additional chapters. Chapter R with the regional extensions. These are classes that have been assigned 6-digit codes based on the frequency in national and regional care registrations. And these regional codes are in the inclusions of the 4-digit classes. For example, Lassa fever, is included in the African version and can be found as an inclusion term in the class AD AD14. So let's look there, take a look there. Let's see AD14. There you see Lassa fever is one of the diseases that are included in this class. If I click on this again, I go back to AD4005. At this moment, there are subsets from Africa, Europe and South America. Chapter 4 contains classes with codes for new diseases that can be used in emergency situations of epidemiological importance given the risk of spread of infections. And these codes, they are all aligned with the ICD codes. And as a final chapter is the extension codes. These codes can be used as additional codes or as additional positions to give more details or meaning to the original code if desired. The extension code should not be used without an initial code. For example, the classification of severity of COPD, open scale values, and of heart failure can be found here. In the next videos we will focus on the chapters A1 and functioning and field testing. Thank you for watching this video.